Hello, welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether you're newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. I'm Ariel, an exercise oncology educator, and today's conversation is on body image and self acceptance after cancer treatment. And following our conversation, stick around for some gentle movement. The information in this video is for educational purposes only, and it's important to consult with your medical care team for more in depth guidance and advice. Let's get started. Changes that occur to the body after cancer affect each person differently. They include hair loss or hair growing back differently, skin changes, visible scars or skin tightness, trouble speaking or breathing changes, weight fluctuations, whether you've lost weight or gained weight, maybe had an amputation, and changes to your sex life and intimacy. And these can be caused by the surgery, chemotherapy, or radiation and other interventions that you may have received. And they might be changes that you only notice, or other people may notice them as well. These losses are real. It's okay to feel upset about them. Feelings of anger and grief about changes in your body are natural. You don't have to go through these feelings alone. Signs that you may need help coping, such as you're embarrassed because you lost or gained weight, you're unable to accept yourself for who you are now, you feel ashamed for having cancer. You don't want to leave your house because you don't want people to see you. You don't want to meet new people or date. You avoid touching, being affectionate, or having sex with your partner. You may be thinking to yourself some of these thoughts that I have written down on this page, and that's okay. These are just a few examples of how deeply rooted body image is in identity, which means your sense of who you are in the world. Some people take longer or struggle harder to come to terms with these changes, and sometimes negative feelings about your changed body can affect your quality of life. For example, I know I should be grateful, and I am, but I'm also discouraged, frustrated, and happy with how my new body looks and feels. I used to be a get things done type of person, but now I take so many breaks that I don't feel productive anymore. I keep questioning whether I'm tired or just lazy. It's hard not to get down on myself. Feelings of grief, frustration, or discomfort with your body are not uncommon, even in the face of survival. These next few slides, I'm going to be talking through some strategies for coping with body image changes. Number one, I believe this is most important. You want to be aware of internal self-talk. You want to offer yourself the same compassion you would give to a friend going through similar circumstances. Practicing positive affirmations is a great way to start. Here are some examples. My body is a reflection of strength and resilience. I accept myself just the way I am. I am learning to love and appreciate my body more with each day. I am more than my cancer, and my body is more than the changes. Number two, taking care of your body. I will be honest, this is much easier said than done, but you want to aim for whole foods, focusing on carbs, fats, proteins, and fiber, of eating less processed foods and red meats, and eating foods high in antioxidants. This can reduce inflammation within the body. Aiming for 6 to 8 hours of sleep per night and exercising at least 150 to 300 minutes, engaging in both aerobic and strength training exercises. And many people find that being active can help their self-image and the way they feel about themselves. Number three, you want to make sure you're seeking support from others. It's going to be hard to heal and recover if you hold it all in and don't let out all the feelings and thoughts that you are experiencing. There are support groups that match volunteer cancer survivors with cancer patients looking for support. For example, ACS Cares, Cancer Fights, Imerman Angels, and I Had Cancer are all great resources to get matched with a volunteer cancer survivor. If you are looking for that peer-to-peer support, you can seek support from healthcare professionals, an oncology counselor, a therapist, an exercise professional, friends, or family members. Just know that there are people out there who do care about you and want to see you thrive through survivorship. Thank you so much for being a part of our conversation today on body image and self-acceptance. I hope the information we've covered has brought you some clarity and comfort. Your health and well-being are what matters most, so please continue to take care of yourself, stay informed, and remember that hope is always present. Now let's transition into some gentle movement to further support your journey.
Hi, I'm Jessica, your exercise oncology instructor with Maple Tree Cancer Alliance. This is week 1 of the 6-week low-intensity HIIT program designed for lung cancer survivors. The goal is to increase your heart rate and lung capacity. For the next 6 weeks, we will move continuously through an exercise for a set amount of time, either 20, 30, or 45 seconds, and then rest for a specific amount of time in between each exercise. The following exercises are meant to be pain-free. If you do notice any pain in any exercises, please skip and go back to what felt good. There may be some discomfort, especially after surgery, but there shouldn't be any pain. If you did have surgery recently and are still healing from that, please work within your comfortable range of motion. Your heart rate is meant to increase, and that's okay. The workouts are designed to be full body and increase your heart rate. Since we will be working for a specific amount of time per set, go at your own pace. You should feel your heart rate increase, but it's up to you to make it as challenging as you need for this week. Let's begin. We'll start with a breathing exercise, and for this you can either stay standing or you can sit. Begin by inhaling through your nose to expand your belly, your rib cage, your chest, expanding on all sides like a balloon. Open up your mouth and exhale, sigh your breath out. Deep breath in, expand. Exhale, sigh your breath out. A few more times. Inhale, expanding as much as you can. Exhale, let it go. 2 more times. Deep breath in. Exhale, release. Last time. Inhale. Exhale, let it go. Great. If you're seated, let's go ahead and stand. Inhale, sweep your arms up overhead. Gaze up to your thumbs if it feels good. Exhale, turn your palms out, face them down. Inhale, sweep your arms up, palms face towards each other. Exhale, turn them away. Inhale, sweep up. Exhale, bring them down. Inhale, sweep up. Exhale, bring them down. One more time. Inhale, sweep up. Exhale, bring them down. Great. We'll loosen up our shoulders a little bit. Start to swing your arms from side to side. Loosen up your knees. Some gentle swings, bringing some movement to our body. And then we'll take our right arm, bring it all the way across our chest. Bring your arm towards it, trying to feel a stretch in the outside of your right arm. Deep breath in. Exhale, sigh your breath out. One more time, deep breath in. Exhale, sigh it out. Going back to those arm swings from side to side, bending into your knees. And then we'll take our left arm and swing it across our chest. Gently pulling our arm towards it until we feel a stretch on the outside here. Deep breath in. Exhale, sigh your breath out. One more time. Exhale. And start to swing your arms again. We'll take one more stretch on each side. And we'll start with our right arm. Gently swinging it across our chest to find your stretch. Inhale. Exhale, release. One more time. Find your arm swings. And then we'll take our left arm and gently swing it across our chest until you feel your stretch, wherever that may be for you. Deep breath in. Exhale, sigh your breath out. Last time. Let's bring in just a few more arm swings each side. And then go ahead and release these swings. We'll interlace our fingers and bring our hands behind our heads. Elbows are wide, chest is open. Exhale as we bring our elbows closer together. Inhale, open. Exhale, close. Inhale, open. Exhale, close. We'll do 7 more. Inhale, open. Exhale, close. 6. 5. 4. 3. 2. Last one. Inhale, open. Exhale, close. Release your arms to the sides. And go ahead, step your right foot in front of you. Bring your left heel towards the floor. Bend into your right knee as much as you need to until you find a stretch in your left calf. If you're feeling a little unbalanced here, if you have a chair in front of you or a wall, feel free to hang on to those whenever you need it. And deep breath in. Exhale, let it out. One more. Go ahead and step back, and we'll switch. Step forward with your left leg. Take your right heel towards the floor, keep it on the ground, and bend into your left knee until you feel a stretch in your calf. Deep breath in. Exhale it out. Deep breath in. And release. Go ahead and step back, and we'll do one more each side. Step forward with your right foot, bend into your knee, find your calf stretch. Step it back and step forward with your left leg. Deep breath in. Exhale it out. One more deep breath. And step it back to center. We'll be balancing on one leg to do a few ankle circles here. So if you do need something to hang on for balance, please feel free to do so. We'll start with our right ankle and slowly start to make some circles here. Continuing to breathe as we do this. And then we'll reverse directions. And then bring our right foot down and we'll switch to the left. Circling one way, you might notice this one feels a little bit different, and that's okay. And then we'll switch directions. Go ahead and bring your left foot down. And now we'll get into some heel-toe rocks. So we're going to rock forward on the balls of our feet. And heels can lift up just slightly if that feels okay for you. And then we'll start to rock back, maybe toes lift. And we'll go forward and back here just a few times. Going at your own pace. Continuing to breathe as we do this movement. We'll do just a few more. We'll do one more each side. And go ahead and release. These next two warm-up exercises we'll do for a minute each. And these are meant to increase your heart rate. The first one, we'll take our heels to our hips. And you can do it standing just like this. Or if you want to increase your heart rate a little bit more, you can hop. Your choice, go at your own pace today. And we'll start in 3, 2, 1. Continuing to breathe as you do this movement. As we go through these exercises, the breath will be very important to keep track of. We're about halfway there. About 15 more seconds. And go ahead and release. Great job. Shake it out a little bit in your legs. I know we're feeling it. This next one we will do for a minute, and we're just gonna step out to the side, back to center, step to the other side, back to center. If you wanna bring a little bend into your knee as you do it, you are welcome to. And we'll start in 3, 2, and 1. We're about halfway there. Making sure we're still breathing. About 15 more seconds. Almost there. Good, and go ahead and release. Shake it out, great job. These next exercises for our workouts we will do for 20 seconds on with a 30-second rest. So these will be low intensity. For this first one, if you do have a chair, you are welcome to use it, but you don't have to. If you don't have a chair, we are just going to be squatting, keeping the knees behind the toes. And if you do have a chair, you're just going to sit in your chair and stand back up for 20 seconds. And we'll start in 3, 2, and 1. Making sure that our chest stays lifted here. Going as fast or as slow as you need to today. About 5 more seconds. Great job. Go ahead and rest for 30 seconds. If you need a drink of water, grab some water. We have about 20 seconds here for our resting. The next movement, we'll be bringing up high knees. And as our knees come up, our arms will come up and then bring both down, working to the other knee and come up. We've got about 10 more seconds. Catch your breath. And we'll start in now. Go ahead and lift up your knees and your arms and switch. Again, going as fast or as slow as you need to. Continuing to bring awareness to your breath and release. Great job. Catch your breath, drink some water. We've got about 20 seconds left of rest. For the next exercise, we're going to step out with one leg as we bring our arms up overhead. Bring the arms down, step in, and then we'll switch sides. Step out, bring arms up and down. That'll be the next movement, and we'll start in about 4 seconds. And begin. Halfway there. Two more seconds. And release. Rest for 30 seconds. Shake it out. Do whatever you need to do. Bringing awareness to your breath, to your heart rate. We've got about 15 more seconds of rest. This next one, we'll have our elbows at shoulder height, and we'll just squeeze our elbows together and then bring them back out. Squeezing together and back out. We've got about 3 more seconds, and go ahead and start. About halfway there. Squeezing and release. 5 more seconds. And rest. Shake it out. We'll repeat those exercises One more time each, and then we'll go into our cool down. So you are almost there. We've got about 20 more seconds of rest. We've got about 10 more seconds, and we'll go back to those squats, or if you're using a chair, you can do those sit to stands, and we'll start in 3, 2, and 1. Begin. Remember, keeping your knees behind your toes here. Chest is open, spine is straight. About 5 more seconds. And go ahead and rest. The next exercise that we'll do here in about 20 seconds is those high knees with those arm lifts. We've got about 15 more seconds here before we go on to the next one. And we'll start in 5, 4, 3, 2, and 1. And go ahead and release. Shake it out. Catch your breath. Bringing awareness again to your heartbeat, to how you're breathing, to how your chest may be feeling. We've got about 10 more seconds, and we'll go into that next exercise of stepping out, bringing our arms up, and then to the other side. And we'll start in 3, 2, and 1. About 5 more seconds. And release. 30 seconds of rest. About 15 more seconds here, and we'll go back into that next exercise of having the elbows at shoulder height, squeezing together, really engaging your muscles, and then bring them back out. And we'll start in 5, 4, 3, 2, 1, and squeeze elbows together, release. Going at your own pace. Five more seconds. And release, shake it out. Great job. We've got one bonus exercise, just like the warm-up exercise, bringing the heels towards the hips. But this time, as we bring the heels towards the hips, we're going to lift our arms up, release, and switch the legs. We'll start that one in about 10 seconds. And go ahead and start. Halfway there. Good, release. Shake it out. Take a deep breath in. Exhale, sigh it out. One more time, deep breath in. Exhale, release. Good, catching your breath. Noticing your heart rate. And let's bring our shoulders up to our ears and back and down our spine. Inhale up, back and down. And you can stay here, or if it feels good, see about making them a little bit bigger, getting our arms in this movement here. And then we'll reverse the rolls. Bring our shoulders up to the ears and forward and down. Up to the ears, forward and down. A few more times here, just like this. And then again, see about making them bigger. Bringing in our arms here for this movement. And go ahead and release. Take your head, gaze out over your right shoulder and to the left. Gaze over the right and the left. One more time to the right, to the left, and this time, take your chin down and around your chest, all the way over to the right shoulder, and down and around to the left. A few more half neck rolls here. Keeping our core engaged. Our chest is high, we're not collapsing. And then we'll bring our head back to center. Clasp your hands together. Reach the mountain in front. Have a little round in your upper spine. And if it feels okay, press into your palms. Inhale them all the way up overhead. Big stretch. And exhale, reach to the right side, breathing into the left side body. Inhale to center and exhale to the other side. Inhale to center, release your hands, bend into your knees, and exhale, fold forward. Let your head hang heavy. Take a few deep breaths. Bend into your knees, press your feet into the floor as we inhale, rise all the way up. Take your hands up overhead again, one more time. Exhale, reach to the right. Inhale to center, exhale to the left. Inhale, center, and last time, exhale, fold forward, bend into your knees. Deep breaths in and out. Bend into your knees, press your feet into the floor as we inhale, rise back up. Thank you so much for joining me for week 1, and I'll see you next week.